According to reports, China is dealing with the outbreak of the HMPV virus. 5 years after COVID-19 pandemic, NDTV has not been able to independently verify these reports, but videos shared online show crowded hospitals, with some users saying that multiple viruses, including influenza A, HMPV, mycoplasma, pneumonia, and COVID-19 are circulating. There are even claims that China has declared a state of emergency, though this has not been confirmed. HMPV is known to cause flu-like symptoms and can also present symptoms which are similar to COVID-19. Health officials, meanwhile, are closely monitoring the situation as the virus spreads. Meanwhile, a news report by Reuters has said that China's Disease Control Authority on Friday has said that it is pivoting a monitoring system for pneumonia of unknown origin, with cases of some respiratory diseases expected to rise through the winter season.
Well, the latest update from the Chinese Center for Disease Control, or the CDC, they have confirmed that, yes, there is a surge in the cases of this human metapneumovirus, or HMPV, as it's called in short. But the CDC has reassured that everyone do not need to be worried, because, it's just like a common occurrence during any flu season. So there hasn't been any rise in the hospitalization rates. Of course, initially there were some rumors about a new strain like causing symptoms, for instance, like fatigue and dizziness among flu patients, but the CDC has clarified that this is not true. The strain circulating is actually the one of H1N1, which is like a common flu strain, and often it is linked to the HMPV virus. And as usual, the CDC has suggested, basic precautions like wearing masks in public, or, disinfecting frequently touched objects, and maybe maintaining like a good personal hygiene. And interestingly, if you look at the data that CDC released, it was actually not specifically about this virus. It was part of like a larger weekly updates or monthly updates that they released, I think, just yesterday. And in this report, in this press release, that's where only maybe one paragraph where they mention about this particular virus. And if you look at the data for the hospitalization rates, or even people visiting the emergency, so for instance, for people going to the hospital, the emergencies or the outpatient departments, HMPV is actually the third most common virus in both northern and southern parts of China. So it means that other viruses like the influenza, flu, or even rhinovirus, they are actually causing more problem than the HMPV. And similarly, if you look at the incidence of severe illness happening, so it is also HMPV is also in the third category. So which shows that flu or pneumonia is like a bigger reason for why people are getting sick as compared to this particular virus. And if you look at what's happening around, like what interesting is that I only came to know about the situation when the different global news outlets, started reporting about it. But if I look at my daily life around in China, it's whether in my office or residential community, I think life is playing completely normal. People are going to work, kids are playing outside, and everything is running smoothly. But yeah, of course, I do understand why people are worried about it. Why there is a sense of concern is because probably it's been just over 2 years where people have the world has come out of the grip of COVID-19. So whenever anything of this sort happens, then people are always concerned that are we going back into the COVID-like situation. But having said that, I think in a nutshell, during flu season, this sort of outbreaks are quite normal, and in life in China is continuing as normal. And what I believe is HMPV isn't something to be worried about, or it is not disrupting our normal lives here.